Hi, my name is Tiara Dennis, and I'm doing number 5 in Group A, and that's to determine current best practices, process, and methods of evaluation related to the barcode medication administration, as well as summarize findings and discuss the implications for nursing practice. The use of barcode medication administration, also known as BCMA technologies, has been recommended by many organizations, including the Institute of Medicine, the National Patient Safety Foundation, the American Society of Health System Pharmacists, and the National Alliance for Health Information Technology. On February 25, 2004, the United States Food and Drug Administration finalized a rule for barcode labeling on medications as well as blood components to prevent adverse effects. The director of the National BCMA Joint Program Office published a report listing 15 practices to maximize the effect of BCMA technologies and reduce the risk of injury to patients, and they are as follows. Number 1, put in place a standing interdisciplinary committee. Everybody should know what their role is and be able to have an open communication with one another. Number 2, train all users as well as cross-train pharmacists as well as physicians. Nursing staff needs to be very comfortable with this program because they're going to be the ones on the front line administering the medications. Pharmacy needs to know what nursing is talking about if there's a problem, and physicians need to know how to properly put in their orders. Number 3, communicate known problems. There needs to be a way that everybody can communicate clearly and openly. Number 4, display contact information for resources to resolve different types of problems. There needs to be a appropriate and easily accessible list for people to call if there's an issue. Number 5, do not employ a double documentation system, meaning do not have a paper-based medication administration as well as the computer barcode medication administration system as well. It always causes medication errors to happen. Number 6, schedule planned downtimes to minimize disruptions. Number 7, replace malfunctioning equipment during its servicing. If there's equipment known to be malfunctioning and not working appropriately, it causes risk to the patient's safety, so that needs to be taken care of as soon as possible. Number 8, develop a procedure for cleaning the BCMA-related equipment, whether it be nursing or housekeeping. Somebody needs to be responsible for this equipment and that it's cleaned appropriately. Number 9, scan the wristbands of medications prior to medication administration. Whether you scan the patient and scan the medication, or scan the medication and scan the patient, both need to occur before the patient is given the medication to ensure that there is not an issue. Number 10, caregivers should personally document the time of medication administration. Don't give a medication and then document 2 hours later that you gave it 2 hours prior. Verify allergy information. Number 11, verify allergy information displayed in BCMA prior to administration. This needs to be done prior to any type of medication giving, not just upon admission. Number 12, support staff personnel should print a report at the beginning of the shift for nurses to use as an overview worksheet, meaning that nurses should just be able to have a printout of what their orders and their medications are for the day. Number 13, nurses should print missed medication reports once a shift, so that way they can see if they overlooked something and it needs to be given. Number 14, alert nurses to new stat orders. This should have a system in which it pops up and tells the nurse that there's a new order that needs to be given or a stat drug. And number 15, replace wristbands as needed and periodically in long-term care areas. They're not made to last forever, and with different conditions of patients, they just need to be changed when the barcode no longer works. Deployment of this technology in the clinical setting requires a thorough and comprehensive approach. It's important to continuously improve the use of technology over time and to tailor these technologies to particular contents. These recommendations are suggestions that identify the challenges as well as the best practices. They should be valuable to others considering procurement and implementation of barcode technology within their system.